Thank you for
Hi.
joining
Thank
us.
you. Thank you for doing
Yes,
this.
no
It's wonderful.
problem. I was just saying that when I went to nursing school, I had a nursing professor say that if you ever had a woman show up and was trying to describe her perimenopausal symptoms, she would be 40, frustrated, and flushed. And that's exactly where I am. And I've always remembered that from nursing. And that seems so far away from me when I was, in my early 20s in nursing school. And now we're here and I am 40s, frustrated and flushed.
Well, the good news is that you're not fat. I was always told it was fat.
Well, yeah, I was going to say that part too, but I was like, I'm going to hold that off.
I know.
But for my audience, I wanted to just say that I know you've introduced yourself, so I was going to take it for you because you said it over and over. Dr. Kagan is, let me see if I get this right. You were the clinical professor of obstetrics, gynecology, and reproductive science at the University of California in San Francisco, and the menopause, bone health, and sexual health consultant at Sutter East Bay Medical Foundation in Berkeley, California.
That's right. Got it. You got it all down. Yes, for sure. Nice to be here. Thank you for doing this. And I'm really happy to share accurate evidence-based information with
and that's what we're here for.
Yes.
So let's get down to it. I know we've had a lot of conversation. We had a conversation with Adrienne and then with Candy. How will we know if we are in perimenopause or menopause? I know you said before in Candy's that people always ask, when am I in it? But I know that's kind of a misnomer.
Thing as being in it. I mean, we look at the stages of reproductive aging, and after your reproductive years, the average age of menopause per se, where somebody looks back and says, oh, that was my final menstrual period, is 51 to 52. Now, there are women that go through this at 40 to 45, as late as 58. But what I tell people is keep a menstrual calendar. And now there's all these apps that everybody keeps. The Menopause Society at www.menopause.org has a calendar in one of their Meno notes that will give you guidelines. Most women start having changes where their menstruation gets a little closer together, like shorter. Some women, they start skipping months. When you have skipped 60 to 90 days, 60 days, that means that you are approaching that time period, what we call the late perimenopause, where men have a lot of symptoms. Some women have no symptoms though, okay? Some women have their symptoms after that final menstrual period. But it's good for us to track what your cycles are like, for us to guide you, and along with the cycles, what are your symptoms?
So that's a perfect segue to my next question. What is your first conversation with women about their symptoms? When they come to you and they say, I think I got it going on, I'm not sure. Like, what's your first conversation with them?
Try to find out anything. Do they notice any mood changes? Are they having trouble sleeping? Are they having hot flashes? They can be daytime or nighttime. And I also try to find out, even though this is a symptom that happens generally a little later with more decline in estrogen, some women do start complaining of vaginal dryness or sex. And yes, there's a big differential diagnosis for that. And there are other reasons for that. But I do try to ask all of those. And I educate people previous to this happening. And because I want them to be aware that these are some of the symptoms. And really, when estrogen levels are declining, it can affect every part of your body. And joint pains, musculoskeletal pains. It's one of the common symptoms of lower levels of estrogen.
What would you say to the woman who is afraid to say it out loud? I'm very mouthy and very, I'm pretty proactive with my care, but I know there are a lot of women out there who are embarrassed or who just don't know how to say it. And, is it okay to say, I just don't feel right? Like, what is the best way for a woman to, because one of the things I wanted to point out too is that only 1 in 4 women actually receive menopause related treatment. So like, what would we say to a woman who's like on the fence about saying something out loud?
Well, I think first of all, it's our obligation to educate and ask. In other words, are you noticing any menstrual changes? Having any symptoms such as blah, 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 blah. We have done a bad job. There is a gap in medical education. There's lots of surveys showing it. We're trying to catch up on it now, okay? But I do think that the burden is, and the obligation should be on us, your healthcare practitioner regardless. And believe it or not, some of the best people practicing now are not physicians. They are nurse practitioners, PAs, people who really have been educated in this and anybody who can help you learn about this. And so I say it's a natural, what we do is we disarm the conversation. Many women, I normalize it. I say, you're getting to that stage of life. There's actual techniques taught to people and how to ask and do the interview. But you normalize it. Gee, while I'm doing the exam, gee, so many women start complaining of problems sleeping. Some women complain of these night sweats or hot flashes. As I'm doing the pap smear, gee, have you had any difficulty? Are you having penetrative sexual activity or not? Are you having any vaginal dryness, bladder complaints? Normalize the conversation so women feel comfortable saying, gee, maybe that's what's going on.
Right.
Yes.
Right. Well, and I appreciate you normalizing it, because there are so many, like you said, that so many women just don't have that normalization. So, that's part of this too, is in giving women the verbiage and what they should be saying. And like, even just like you said, maybe when you're with your care provider, say, gee, I haven't slept well, or, bringing up these symptoms in hopes that it starts a conversation.
Absolutely. Especially if so many good resources for education, as well as good evidence-based treatments for symptoms. And so it's really important. And another really important reason for keeping, say, a menstrual history prior to that final menstrual period is that women can have a lot of abnormal bleeding, and they may think it's just their period, when actually it could be a sign of a precancerous condition that needs evaluation, or even uterine cancer. So it's really trying to empower women, yes, as they give them permission to talk about all of this in a safe space.
Sure. Can you talk about the range of effective treatments for menopause treatments? I know that we only have a very short time, so that's kind of a little question.
Important that I want to give out to people is that for the last 20 years, the reason people don't know anything is there was this big study that was in the news. Maybe many of you were not around, or you were in grade school at the time, but it was called the Women's Health Initiative. There was misinformation presented to the public, and it was a preventive health trial, but everyone threw out their hormones. And then people didn't learn about hormones. People didn't even learn about how to take care of women. Every single medical society, without a doubt, endorses estrogen, and if you have a uterus, you need a second hormone called a progestogen to protect the lining of the uterus, from any buildup. But estrogen is the treatment of choice if you don't have a contraindication for hot flashes, some of the moods, the sleep issues, and women should not be deprived if they are starting it under the age of 60, which is the average, or in the first 10 years since their final menstrual period. That study was reanalyzed and found out that the benefits outweigh the risk. Now, there are women, as you and I know, that can't take estrogen or won't take estrogen.
Right.
If that's the case, we have very good alternatives as well that are pharmaceutical. There are not that many Lifestyle's great. I mean, it's healthy, it's wonderful. But there are not that many what we call evidence-based cognitive behavioral therapy helps, weight loss helps. I mean, there's a few other, it feels good to do yoga, but the data's mixed. Acupuncture, the data's not really there. But if it helps you feel better, sure, it's not going to hurt you. There's a huge placebo response to everything that we often give. And that's why we need to show efficacy that something works over a placebo.
Right. So how do women get connected to care? How do, all of these treatments that you're mentioning, and, how do they get connected from I'm having these symptoms to
Well, first of all, there are many, many good resources at that www.menopause.org. I mean, what you can do there is find a clinician. You put in your zip code and you put how many miles you're willing to go, although people do a lot of video visits now too. And you can find a clinician who's either a member of the society, because maybe at least they've learned something, but you're really often now, there is something called an MSCP, Menopause Society Certified Practitioner, and I took the first exam many years ago. So you know that they know something basic. On the other hand, I think that if somebody is trying to push products like pellets, which are against the FDA, are very dangerous,
Mm-hmm.
or even this compounded bioidentical hormones. Bioidentical just means mimicking what your ovaries put out. Oh,
Right.
so estradiol, estrogen, and progesterone. But we have FDA approved products. And if you can't take that, then we have this new agent called Veoza. We have a drug called Brisdel, which is a low dose of an antidepressant called Paxil that we now have also effective. And we have many other, what we call off-label. Some women sleep use gabapentin. That means that it's not, been studied for that indication, but it is safe, effective. And so we do have other options for women. The main message is that people should not suffer in silence. Many years ago, this woman, none of you would know who she is, Gail Sheehy, wrote a book called The Silent Passage. I mean, it was a long, long time ago, but somehow we couldn't get it out of the closet.
Yep.
And now we're trying to get menopause and help out of the closet and realize that women live a long life. You're going to live a third to a quarter, even half of your adult life in this time period. All right. And have new careers postmenopausally, new life, new marriages. And there's no reason for people to be suffering from these symptoms.
And that's what I always say. It's, you have to say the quiet parts out loud, particularly when it comes to menopause.
I know.
You're already out of time. I can't believe it. It went like this. I can't believe it. I would encourage my audience to head over to Tamika Talks. Dr. Kagan is going to talk to Tamika about breast health and menopause. And I can't say thank you enough for giving me these few minutes of your time. It was a really informative conversation.
I thank you for doing what you're doing and trying to get accurate information out to women and make sure they realize that there's a lot of help out there, and knowledge is power. Yes. So just keep that. And don't let anybody rip you off, because there's a lot of stuff out there that's ripping people off.
Well, we appreciate all of your help and your advice, and I'm going to see you over on Tamika.
Okay, good, great.
Bye-bye. Take care.